And joining me now is CDC Director, Dr. Rochelle Walensky. Dr. Walensky, welcome back to Meet the Press.
Thank you. Good morning, Andrea.
Good morning to you, and it's good to see you. Let's talk about the boosters. So the approval for booster shots this week makes a big difference, but there's a lot of confusion, first of all, for Johnson & Johnson recipients. Why is it so important that they consider boosters, and do you recommend the mRNA boosters, getting Moderna or Pfizer for them?
Right. This has been a really important next step in our booster campaign across America because we now have a booster plan for all three of our vaccines. For Moderna and Pfizer, if you're more than 6 months out, you may be eligible for a booster. And what we said for J&J is that if you're 2 months out of your last shot, you are eligible for a booster. And then finally, this plan to have recommendations towards mix and matching. The FDA and the CDC saw a lot of data over the last week. We saw data from the NIH on mix and match that antibody levels for the mRNA vaccines boosting the J&J were really, really high. And we also saw clinical data from J&J that said if you're boosted with J&J, you actually do quite well as well, which is why we've really left it open and said any one of these vaccines can really be used to boost any one of the others.
Now, I've spoken to a couple of doctors, some of our experts, who say that confusion is actually good for the body, that if you had Moderna, 2 shots of Moderna, well, try the Pfizer booster and vice versa. Is it good to give them, for people to get something that does have a different kind of antibody for that COVID spike?
You know, that's an important question, and it's not necessarily one we have definitive science on right now. We will absolutely be studying that. But what we do know is that it looks very effective. It looks effective in the clinical studies. It looks effective in the antibody studies. And it looks very safe as well. Is there an absolute preference for one or another if you got an mRNA vaccine versus a Johnson & Johnson vaccine? We really do see great clinical benefit for both.
Now, the other problem that it begins to develop is that just during the last couple of weeks, we're seeing more people getting boosters than getting their first shots. So is all the focus on boosters going to take away from the bigger problem, which is to get more people vaccinated, at least with their first doses?
Andrea, this is such an important point. We have 64 million Americans who have still not yet rolled up their sleeves for an initial booster shot, and we are vaccinating them at about 250,000 a day. We are continuing active outreach, active communication, active discussions with trusted messengers to really work to scale that up. In the meantime, in parallel and without losing any of that effort in getting people vaccinated for the first time, we are rolling out this booster plan, and people are coming. They are interested in getting their boosters.
Let's talk about kids 5 to 11. The initial data is certainly reporting that the FDA, in fact, believes that there is really a positive effect and very low risk. You're going to have the advisory, the FDA advisory on Tuesday. Just when do you think, all things being equal and no big surprises, that these children, these little children, could get vaccinated?
Right, great. So between the ages of 5 to 11, the FDA will be reviewing those data this week. They will have a lot of science to review, and over the coming week, we are hopeful to hear from them by the beginning of the following week, and that's when the CDC will have their meeting. And I will be ready to take action if all of that goes smoothly as soon as possible. In the meantime, the administration is working on the operations and the logistics, so as soon as we have both the FDA authorization and the CDC recommendations, there will be vaccine out there so children can start rolling up their sleeves.
Now, according to the latest data from Kaiser, you have a fully 1/4 of the American parents saying that under no circumstances would they let their kids get vaccinated. A third would, a third want to wait and see, but 1 in 4 do not want to have vaccinations, even though for decades children have been vaccinated. So how do you reach those? And if you don't reach those people, that's a big number. Can you get the herd immunity in schools that you really need?
Right. This is critically important, and we know we have a lot of work to do. And in fact, those survey data look very much consistent with where we were with adults in last December when we rolled out vaccines for adults. So we have done a huge amount of hard work over the last 10 months. education, communication, providing information, getting vaccines to really convenient places, trusted messengers, making sure those vaccines are in pediatricians' offices and children's hospitals and pharmacies where parents trust vaccines being given. And so we're doing absolutely all of that hard work now, and we have that hard work to come for both our children as well as our parents and for the 64 million people who have yet to roll up the sleeves themselves.
What is your advice to parents and to schools regarding lifting mask mandates in schools once children are vaccinated? You know, our case numbers are coming down, and that is so encouraging. We still have 75,000 new cases a day of COVID, and we are still having death rates of about 1,200 to 1,500 deaths per day. As we roll out these vaccines for our children, and we are hopeful that we will be able to, it's also critically important that our kids are able to stay in school. We saw just a couple of weeks ago new science that demonstrated that schools that masked had 3.5 times less likelihood of having outbreaks than schools that didn't. And so in my mind, the most important thing right now, as we work to get our cases down, as we work to get our children vaccinated, is that we continue the masking to keep our kids in school. Now, I want to play something. The last time you were on Meet the Press, last May, this is what you had to say about lifting mask mandates.
We are asking people to be honest with themselves. If they are vaccinated and they are not wearing a mask, they are safe.
Did you move too soon on that? Was that a mistake?
You know, that was at a time of the Alpha variant when vaccinated people, if they were a breakthrough infection, could not transmit the Alpha variant to someone else. This is really an opportunity to understand that we have to be humble with the science and to move with the science. As we have learned with this Delta variant, it's a different variant, it's a more transmissible variant, and it behaves differently in the context of breakthrough infection. So at the time, that's what the science told us we could do. We are in a very different moment with a very different variant.
How worried are you about this Delta Plus that's surging in the UK, about it coming here? We don't have enough testing to really know how much is out there.
We absolutely are following the genomic sequencing of this very carefully. This is, I think you're referring to the AY4.2 sublineage. It is a variant of the Delta variant. It has several mutations on the spike protein that we have not yet seen implicated in increased transmissibility or in decreased ability of our vaccines or our therapeutics to work. We're watching it very carefully. We have had a handful of cases here in the United States, but it has not taken off as it has in UK.
Could there come a point where we're going to have to, again, stop flights coming in from Europe or the UK because of this?
We're not anticipating that now. We are absolutely following the science very, very carefully, but we're not anticipating or looking into that right now.
Dr. Rochelle Walensky, thank you so much for being with us on Meet the Press.
Thanks for having me, Andrea.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.